India is the diabetic capital of the world, and today we are at the launch of a revolutionary drug. Thank you, Dr. Anil Pareek, for joining us, and it's congratulations for the launch. So it's a very alarming situation in India. So can you share some statistics of diabetic foot care?
See, diabetic foot ulcer, because type 2 diabetes is galloping in India.
Absolutely.
I said it's galloping in India. So the recent ICMR-INDIAB survey, which was carried out under the auspices of Indian Council of Medical Research,
Right.
that showed very frightening statistics for diabetes, type 2 diabetes in India, which is around 101 million people with diabetes, more than 10 crores, and 136 million people with pre-diabetes. So where glucose is not normal, neither in the diabetes range, but before that. So it is pre-diabetes. During that stage also complications occur. So it's very important to know. So that's why pre-diabetes also assumes importance. So that makes 27% of the adult population in India will have either type 2 diabetes or pre-diabetes. And why we are why we need to be aware about type 2 diabetes, because it is associated with all chronic complications.
Right. Sure.
So you have to take care of these complications where you need to manage the diabetes well.
Sure.
So first place, you should prevent from happening diabetes. You should see whether you are at risk for type 2 diabetes.
Right.
Any adult which is can himself undergo and see whether he is at risk for diabetes based on his family history, whether his parents, siblings,
genetic,
then his obesity level. And the ICMR-INDIAB survey also suggested that the rate of obesity is also increasing in India.
Right.
So the urban-rural divide is decreasing now.
Right.
So that is also happening. So it is also spreading in the rural part as well, quite rapidly. So this is where the obesity in the Indians is typical, because it is around the tummy. It is called a central obesity.
Right.
So this central obesity also is having fat inside the viscera or the internal organs of abdomen. Like you have liver, like you have pancreas. So this is where it gives rise to insulin resistance. Where insulin is not able to do its job of putting glucose inside the cells, rather than in the blood. So that is how blood sugar is rising. So this is where we should take care of. And the abdominal obesity, waist circumference, if it is high, like ideally they say a female should have less than 80 centimeter of the waist of the circumference, and a male should also have less than 90 centimeter. So which will be.
And how about the hip obesity?
Hip obesity, other is around the hip obesity is not found to be so dangerous as compared to the central obesity. So which is we are worried about the abdominal obesity. And when a person has abdominal obesity, he has fasting glucose which is high initially, not in the diabetes, but impaired fasting glucose. His 2 hours postprandial after meal, after taking the food, his 2 hours glucose is not less than 140. It is between above 140. If it is above 200, it is diabetes. So this is where and then the diabetes gives rise to complications of the blood vessels. So not only metabolic disorder, but blood vessel disease, vascular disease. So microvascular, macro, large blood vessels, small blood vessels. Small blood vessels will give rise to complications in the nerves, nerve ending neuropathy. So sensation will be lost, muscle power will go down. So neuropathy, then nephropathy, kidney involvement, retinopathy, retina getting involved, so vision gets affected. Larger blood vessels means coronary artery disease, cerebrovascular disease, and the peripheral vascular disease. So peripheral vascular disease and neuropathy is where we are afraid of diabetic foot ulcer, because circulation gets compromised and the sensation gets lost. So this combination creates, patient is not aware of injury.
Sensory.
And his foot is, loaded in a different side. So there will be pressure ulcers. So So need to be aware of these things.
Right. So how many amputations on average in a year in
See,
India?
on an average, say about say if you say the incidence of diabetes is around say around 10 crore people will have type 2 diabetes. So eventually 10% of them, the statistics varies 5 to 15%.
Okay.
5 to 15% of this population is prone to diabetic foot disease in throughout their lifetime, not 1 year, but throughout their lifetime, it will be 10% people will get diabetic foot disease. And this will then result into diabetic foot ulcer. So a huge amount of burden is there.
Yes.
And if you don't take care of it is also prone to infection. And then circulation is not there, the tissue gets, dead tissue is there.
Right. Takes a lot of time to recover.
You will find that the blackish discoloration of the nails taking place, and then the blackish discoloration proceeds further because that much tissue is not getting circulation.
Okay. Right.
So when the heart muscle doesn't get circulation because coronary arteries are blocked, you get heart attack.
Right.
Or if it is not completely blocked, you get angina.
Right.
But here you have peripheral vascular disease.
Okay.
So those and neuropathy. So this and hyperglycemia. So this we can call it the triad of very high blood sugar, peripheral vascular disease, blood vessels getting affected, circulation compromised, and now peripheral neuropathy. Now sensation gone.
Okay.
The power of the muscle in the legs is gone. So this is creating a very dangerous situation. So there is a need to address this.
Absolutely.
This is where it is coming.
Sure. So what is the beauty of this product?
See, why one of the pathophysiology in type 2 diabetes is that glucose is excess.
Right.
So normally glucose gets converted into energy. That is why glucose is important. Brain requires glucose as a source of energy.
Sure.
So glucose as a source of energy is very important. But type 2 diabetes are fatigued because glucose is there.
Right.
But glucose doesn't go inside the cell where it is required.
Exactly.
It is in the blood.
Yeah.
So this is the problem. So because of this, the normal pathway of glucose to energy, hexokinase pathway, that gets saturated.
Yes.
So the glucose is diverted to sorbitol and fructose.
Okay.
And this is harmful.
Right.
So this is creating the problem of circulation getting compromised, ulcer taking place, neuropathy is taking place. So if you can prevent this harmful formation of sorbitol and fructose by inhibiting that pathway, enzymatic pathway called as aldose reductase pathway. So it's a biochemistry which you require that knowledge to understand.
Yeah. Sure.
So this product blocks the aldose reductase pathway locally.
Okay.
It's a topical product. And that's how it is helps in healing of the ulcer.
Okay.
So you require a lot of supportive therapy as well. You need to do cleaning of the wound. You need to keep the foot well hydrated. You need to take the pressure off the foot, which part is where it is getting the pressure.
Right.
So many things are required to get the. If there is infection, treat the infection.
Right.
So till now there was no product which was acting on this particular pathway and helping the ulcer heal. I would not say that this is the only thing which will heal the ulcer. This is supportive.
Okay.
It will also add to, but it is addressing a basic pathophysiologic defect. So it is that way it will help in adding that. But you need to also take care of the circulation.
Okay. Right.
Take care of the infection. Take care of the blood glucose because ultimately it is the elevated blood sugar which is causing a problem.
Absolutely.
So hyperglycemia needs to be treated and managed well.
Right.
This is the important part.
So can you talk to us about the partnership with NovaLead and what kind of government support have you got?
We don't have any government support because the product has been developed by NovaLead.
Right. Okay.
So NovaLead has partnered with the Department of Biotechnology. DFU.
Okay.
So it received funding from the Department of Biotechnology.
Okay, sure.
And then it developed, used that money for clinical development of the product, carried out phase 3 studies in 27 centers across India. So we found that this is interesting. So we approached NovaLead and in-licensed the product.
Okay, all right. So what's your future roadmap?
Future roadmap would be to spread awareness of diabetic foot. Diabetes in general, actually we need to be aware.
Right,
we need to prevent obesity, but it is easier said than done.
Okay, right.
So isn't it?
Yeah. Can you throw some light on the juvenile diabetic situations?
See, juvenile diabetes affect about 5 to 10% of the of the diabetes population.
Sure.
Predominantly it is 90% is type 2 type 2 diabetes. So juvenile is means it takes place during early childhood.
Right.
In type 2 diabetes, the predominant pathology is insulin resistance.
Okay.
And then beta cell gets affected of the pancreas.
Right.
Beta cells of pancreas produce insulin. So initially there is insulin resistance and increased insulin secretion.
Okay.
But once the diabetes sets in, 50% of the beta cells don't function.
Right.
So there is twin defect. Insulin resistance one part, insulin deficiency later on.
Okay.
While in type 1 diabetes, there is a beta cells are destroyed because of autoimmunity.
Okay. Right.
So this autoimmune disorder which is destroying the beta cell, so there is no insulin.
Okay.
So oral drugs don't help. You need to have insulin.
Okay.
While to take care of insulin resistance, you have so many drugs.
Right.
Or increase the insulin secretion. Already some beta cells are functioning, so you can increase the insulin secretion.
Okay.
In type 2 diabetes, so there are oral options, oral drugs.
Sure.
But there only insulin is the option in the type 1.
Right. Can you suggest a healthy diet for Indians?
So Indians, it is found as compared to the other Caucasian population that Indians consume high amount of carbohydrates.
Yes.
So refined food,
right, packaged foods,
high packaged food, refined food. And high amount of chapati and or roti or rice.
Right. So that should be cut down in protein.
Cut down. We need to increase the the protein part of in our diet. So you need to get educated which are the vegetarian sources. If you are a vegetarian, then you need to find which are the vegetarian sources and how we can improve that. How you can improve the vegetables more in the diet.
Okay.
The raw vegetables, salad and all those things. So how you can help in all these things. This is where it will go. So you have the dedicated dietitian who will guide you. So what type of food? Then important also to increase the physical activity.
Yes, exercise.
Because now sitting is the new smoking.
Oh my God.
So if you prolongly so every 1 hour you should get up.
Right.
Preferably every half an hour, but every 1 hour you should get up. Don't stay.
Sure.
Because sitting is the new smoking is the dictum. So you need to be active.
All right.
So the mantra is to be active.
Mantra for a good lifestyle.
Reduce carbs. And be aware. So do frequent monitoring and see whether if you have any problem, address it proactively.
All right. Thank you so much, Dr. Pareek, for sharing the insight. It was wonderful talking to you, and congratulations again for the revolutionary launch. Thank you so much.